This is a map by SPA. You can see SPAs 6 and 7 have the highest diabetes rate, quite alarming. There's a tremendous amount of morbidity and mortality associated with diabetes, tremendous cost to the healthcare system, and a lot of this is preventable diabetes through diet, exercise, better lifestyle. Looking at the obesity rate geographically, this is a map that highlights obesity change from 1999 to 2007 by supervisorial district. And you can see here again, yes, we are getting fatter everywhere. I also put this slide in to highlight to you that if you are working on advocacy, we can provide data by political districts as well. And politicians, policymakers like to hear stories and first-hand accounts of things about from their constituents, but numbers go a long way too. Another problem in LA County is our mental health system. We don't have enough access for all the people with problems. I put in this slide to show there has been an increase in diagnosed depression, and this could mean that people are getting more depressed in LA County over the last decade. But I like to think this actually reflects better access to care, to mental health care. And particularly looking at the green line, African Americans, diagnosed depression, these are people who have ever been diagnosed with depression, not who are currently depressed when we call them, jumped from 10% in 2002 to 16%, almost 17% in 2007. And during that period, there's been a lot of work in the African American community by helping African American families, California Black Women's Health Project, doing outreach and trying to decrease the stigma around mental illness. I'd like to think that's why we're seeing higher rates of diagnosed depression in the Black community, not because people are suddenly getting depressed, but because they're actually getting help and getting a diagnosis. In the Asian Pacific Islander community, we haven't seen much of a change, but whites and African Americans are now at the same level of diagnosis. This slide looks at maternal depression, and this is for mothers of children 0 to 17 years. These are people who responded to our parent survey. And there's two graphs. The first one on the left are people who have ever been diagnosed with depression. Again, being diagnosed with depression as a marker of access to care as well as their mental health history. And you can see the red bar are Latinas. They are below the county average in terms of having a history of diagnosed depression. And whites and African Americans are both up around 19–20%. Asian Pacific Islanders down the lowest, 4%. When you look at the second graph on the right side of your slide, this is a measure of current depressive symptoms. We ask them a series of questions that is designed to assess their current mental health state, if they're depressed, if they're crying, if they're irritable, things like that. And we found that Latinas are well above the county average in terms of having current symptoms that put them at risk for depression. So that indicates there's a population there that needs help that isn't getting it. And the Asian Pacific Islander women also increased from 4% to 9%, suggesting that there's more people that have symptoms of mental health issues that are getting help. What are we doing about all this? Main thing in public health these days is policy. We do a lot of health education and all kinds of programs and some direct services. But historically, as I think all of you know, policy is a way to affect the most people. By changing policy, we've improved sanitation, we've improved tobacco smoking rates by changing the laws, and the Department of Public Health created the PLACE program, which is Policies for Livable, Active Communities and Environments, which is sort of spearheading our policy work in the department. And they're doing great things, partnering with chronic disease and planning and everybody else. Just some more examples of policy. One thing that we're working on in public health is the built environment. All of these factors affect our health tremendously: the air quality, the way our communities are designed, whether or not people have places for physical activity to get their exercise, if they can use mass transit instead of driving everywhere, zoning requirements to see what stores are built where, what markets are available, which communities, the way we market foods to our kids, and of course neighborhood safety, very fundamental. Public health is doing a lot to address the obesity epidemic. These are all factors that, of course, are fueling it: limited access to healthy, affordable foods, abundant, inexpensive, unhealthy foods, like we talked about earlier, food marketing practices, selling kids sugary cereals, soda in schools, families not having time or know how to prepare healthy meals, physical activity resources, and of course unsafe neighborhoods. So the menu labeling law, you're probably all familiar with. The department did a health impact assessment in 2008, and by 2011 we will have menu labeling in the statewide. but the public needs to be educated. There's a great program that Healthy Eating Active Communities did at the Mercado La Paloma downtown, the Smart Menu Project, where they worked with all the little food stands in Mercado La Paloma, analyzed their meals, and posted the results on menu boards. And the public can now go in there and see what they're eating exactly, and it can actually be a good response. And the merchants were all, I mean, there's some resistance at first to have all of your meals analyzed to see, you know, wow, this burrito actually has 2,000 calories, and I don't want to know that, I don't want my customers to know that. But the nutrition program, and he, after working with these merchants, discovered that it could actually be a very productive project for everybody involved, and the public has responded well. So some mentioned here the moratorium on fast foods. This was done by the LA City Council, but that's the kind of policy we're talking about, and it has a lot of impact on what people do. And just some kudos to community health councils for their excellent report on community food environments, and Network Healthy California, who they do those ads you see around town where women are trying to take control of their kitchens and their houses and empower people in our communities to take care of their families and make a live healthier. Physical activity promotion. I'm going to skip through this because we're at the end of our time. Basically partnerships with the schools, with some public industries, with private industries, trying to improve physical activity opportunities throughout the county and for people of all ages. And this is some contact info for us. If you ever need data, please let us know. This is our main phone number and website. I'll take any questions you have. Thank you.
There's one over there.
So you could drill down on some of the data that you wanted by service planning area, like spot 6. Drill down on some of the other elements that were in the, you could drill down on some of the other elements that were in the report. All that number.
It depends on the indicator. Something like diabetes that has a 9% prevalence, we can't drill down as far as we can with something like obesity, because higher numbers give us more power to explore. But if you let us know what we need, we'll try to help you.
Dr. Lewis?
There's several of us here in this room who run community health centers. I'd like to know what you meant by your opening remark, that you provide immoral care.
Well, I wasn't saying that you provide oral care. I volunteer at Zelman Free Clinic. I've been before that I volunteered at Dentistry Clinic. I love community health centers. My comment referred to us working in a county that can't possibly serve all the people who need help. So I have patients who needed specialty referrals. That's taking years to get them the help they need. And it's fundamentally wrong. You know, people say we have the best health care in the world, and yet my patients can't get a renal biopsy for proteinuria for lasting 2 to 3 years, 4 years.
I think we all face that frustration, but I don't think that is a reflection of what we do in clinics. Much care. I just challenge the way you say it. Mark, I'm sorry.
I live, that's
fight with you, but you know, I spent 19 years doing this in my clinic, and I think we run a pretty damn good medical home for about 25,000 patients, and I know the frustrations that I can't get a patient into County USC for a year to get a...
That's what they refer to, not that...
That's not my problem, that's the county's problem. It's my problem, but I can't budge the county to get them on a treadmill or to get doctors in there and do the things that need to be done.
Well, what I'm saying is the greater...